Psychedelic mushrooms, commonly known as magic mushrooms, have been used for centuries in indigenous rituals for their mind-altering effects. The active ingredient in these mushrooms is psilocybin, which, when ingested, converts into psilocin and interacts with serotonin receptors in the brain. This leads to altered perceptions, changes in mood, and sometimes profound shifts in consciousness. Historically, these effects have been part of spiritual and healing practices, particularly in indigenous cultures across the Americas. In recent years, however, psilocybin has gained significant attention for its potential medical benefits, particularly in the treatment of mental health conditions like depression, anxiety, PTSD, and substance addiction. Several clinical trials have shown promising results, especially for people who have not responded well to traditional treatments. Unlike typical medications that are taken regularly to maintain stable levels in the body, psilocybin works differently. Once ingested, it affects serotonin receptors, which play a key role in mood, cognition, and perception. Psilocybin alters how these receptors function, leading to temporary but powerful changes in brain activity. This allows for new patterns of thought and perception, which can help individuals gain a fresh perspective on their mental health challenges. While the effects of psilocybin are intense, they're typically short-lived, lasting only a few hours. However, in controlled therapeutic settings, these few hours can lead to significant long-term benefits. Many patients report lasting improvements in their mental health, even after just 1 or 2 guided psilocybin sessions. The promise of psilocybin in mental health is truly fascinating. What makes psilocybin particularly intriguing to researchers is its ability to reset or rewire the brain's neural networks. This is especially helpful for those suffering from treatment-resistant depression or end-of-life anxiety in terminally ill patients. In these cases, psilocybin seems to break down rigid patterns of thought and allow for more open and flexible thinking. Unlike many typical medications for depression or anxiety, which often work by suppressing symptoms or stabilizing mood over time, psilocybin appears to go deeper. It can create an experience that helps individuals confront their emotional and psychological challenges from a new perspective. The future of psilocybin in medicine is something many are keeping an eye on. Although the research is promising, psilocybin is still classified as a controlled substance in many parts of the world. However, there has been movement toward decriminalization and medical use in places like parts of the United States and Canada. As more studies emerge, it's likely that we'll see further exploration of its therapeutic potential. While psilocybin might not function like a typical drug, its ability to foster deep personal and psychological healing shows great potential, particularly for those who haven't benefited from conventional mental health treatments. The future of psilocybin in medicine looks promising, but much research is still needed to fully understand how it can be integrated into mainstream mental health care.